Sri Gurubhyo Namaha. Good evening to all of you. Now we will start with Organon. Hanuman's Organon. One. Now we will read 291, aphorism 291. Baths of pure water prove themselves partly palliative, partly as homeopathic serviceable aids in restoring health in acute diseases as well as in convalescence of cured chronic patients, with the proper consideration of the conditions of the convalescent and the temperature of the bath, its duration and repetition. But even if well applied, they bring only physically beneficial changes in the sick body. In themselves, they are no true medicine. The lukewarm baths at 25 to 27 degrees serve to arouse the slumbering sensibility of fiber in the apparent dead, frozen, drowned, suffocated, which benumbed the sensation of the nerves. Though only palliative, still they often prove themselves sufficiently active, especially when given in conjunction with coffee and rubbing with the hands. They may give homeopathic aid in cases where the irritability is very unevenly distributed and accumulated too unevenly in some organs, as in the case in certain hysteric spasms and infantile convulsions. In the same way, cold baths 10 degrees to 6 degrees in persons cured medically of chronic diseases and with a deficiency of vital heat act as a homeopathic aid. By instantaneous and later with repeated immersions, they act as palliative, restorative of the tone of the exhausted fiber. For this purpose, such baths are to be for more than momentary duration, rather for minutes and of gradually lowered temperature. They are of palliative, which since it acts only physically, has no connection with the disadvantage of a reverse action to be feared afterwards, as takes place with dynamic medicinal palliative. So he is discussing about some baths. Now we will go through the commentary of Master E.K. స్వచ్ఛమైన జలములతో స్నానము చేయించుట వలన రోగికి కొంత బాధోపశమనము, కొంత సారూప్య వైద్య ప్రక్రియ కూడా జరుగును. With pure water, if we give bath to the patient, two benefits will be there. One is some amelioration from the suffering, and also some similarity to the condition. ఇవి త్వరగా ఆరోగ్యము చక్కబడుటకు సహాయపడుటకు తరుణ వ్యాధుల వైద్యమునందును దీర్ఘ వ్యాధుల వైద్యమైన తరువాత కోలుకొనుటయందును ఇవి ఉపకరించును. సో this type of baths, they will help to restore, to convalesce quickly in both acute diseases and also after the cure of chronic diseases. When convalescence is delayed, these types of baths will improve the period of convalescence. కోలుకున్న వాని దేహ పరిస్థితిని బట్టి స్నానములను చేయింపవలెను. We have to decide about the temperature and the frequency of baths basing upon the condition and of the patient, up to which extent there is improvement. రోగి స్థితి అనుకూలముగా నీటి ఉష్ణత స్నానము చేయించు కాలము రెండు స్నానముల మధ్య వ్యవధానము నిర్ణయింపవలెను. So basing upon the condition of the patient, we have to decide about the temperature of the water, with what frequency we have to use the bath, how much of the time gap should be there, that we have to decide. తిన్నగా అనుకూలముగా వాడినను వీరి వలన కలుగునది రోగి భౌతిక దేహమునకు సంబంధించిన అనుకూలత మాత్రమే. Even though we take all these precautions, actually what happens, there will be the amelioration or palliation or improvement or comfort on the physical plane of the patient. స్వయముగా వాని యందు వైద్య ప్రక్రియ ఎట్టిదియూ లేదు. By themselves there is no medicinal action in them. చనిపోయినట్లు కనిపించు వారిలో నరముల చైతన్యము మందత కొని ఉండును. అట్టి వారిలో కురికిపాటు పడుతున్న చైతన్యమును మేల్కొల్పుటకు గోరువెచ్చని నీటితో స్నానము 25 నుండి 27 డిగ్రీల ర్యూమర్ ఉష్ణోగ్రతలో పనికివచ్చు. In apparently dead people, in whom the nervous system is very weak, it is dull, then by giving bath with 25 to 27 degrees water, it will improve. ఇవి కేవలము ఉపశమనమునే కలిగించును గాని ముఖ్యముగా రోగికి కాఫీ ఇచ్చి చేతులతో దేహము తోముచు స్నానము చేయించినతో చక్కని చురుకుతనము కలిగించు. Apart from giving a bath, we should give massage to the body, and also we should give hot coffee to the patient. That also will help, because basically they are coffee drinkers. So that also will help. In some cases, with the heart, in one case, who was poisoned with sleeping tablets. One boy, he was poisoned with sleeping tablets. For the sake of suicide, he took sleeping tablets, many sleeping tablets. He was apparently he was dead. Once I went there. Immediately I gave him opium 200. After 15 minutes, I gave him opium 1M. After giving opium 1M, in half an hour there was little improvement. After half an hour again, I gave him another dose of opium 1M. There was much improvement. The action of that sleeping pills was almost neutralized. But the patient was not cooperative. He has no intention to wake up. Though he was conscious after giving a second dose of opium, he was not having any intention to wake up and to come to normalcy. He was lying in the same way. I could understand. Immediately I brought very hot coffee and I put the glass on the forehead and on the hands. Immediately he sat down. And he talked normally. శరీర చైతన్య ప్రకోపము ఆయా భాగములలో ఎగుడు దిగుడుగాను క్రిక్కిరిసి ఉన్నను, కొన్ని అవయవముల్లో ఎక్కువగా సమ్మర్దము కలిగి ఉన్నను ఈ స్థానములు సారూప్య సాధన కలుగు చేయును. When the vital force is congested at a particular place or in irregular distribution, in those cases it will help. ముఖ్యముగా హిస్టీరియా వ్యాధిలోను చిన్నబిడ్డ చేష్టాను వ్యాధిలోను కలిగిన బిగింపులను సడల చేయును. చిన్నబిడ్డ చేష్టలు ఉంటాయి. చిన్నబిడ్డ చేష్టలు అంటే ఏంటి? ఫిట్స్, ఎపిలెప్సీ in children and also in hysteria cases, when there is stiffness, this type of treatment, it will relieve the stiffness. ఇవి గోరువెచ్చని స్నానముల ఉపయోగములు. సో దీస్ ఆర్ ది బెనిఫిట్స్ ఆఫ్ ల్యూక్వారం వాటర్ బాత్. అదే విధముగా సన్నీటి స్నానములు కూడా ఉపయోగపడదు. విత్ కోల్డ్ వాటర్ ఆల్సో దేర్ ఆర్ సమ్ బెనిఫిట్స్. 10 డిగ్రీల నుండి 6 డిగ్రీల వరకు హ్యూమర్ ఉష్ణోగ్రతల నీటితో స్నానములు దీర్ఘవ్యాధులందు ఔషధ సేవనము చేయుచున్న వారికి ఉపకరించు. ఇన్ chronic diseases sometimes along with the medicinal treatment, giving baths with 6 degrees, 10 degrees to 6 degrees water, that will also help. జీవశక్తి పుట్టించు వేడిమి తక్కువగా ఉన్నప్పుడు ఈ చన్నీటి స్నానములు సారూప్యమునకు సహకరించు. When the vitality is low, then these types of baths will act as similar methods. ఆకస్మికముగా చన్నీరు జల్లుటయు, తరువాత అనేక పర్యాయములు చన్నీటిలో మునుగుటయు బడలిన పట్టు తప్పిన దేహధాతువుల పుష్టిని సమకూర్చుటకు పనికిరు. So sprinkling cold water, that we will be seeing frequently when a person has fall down with epilepsy. After sprinkling some cold water on the face and body, he comes to consciousness. So doing those things, they will help to relieve the stiffness, and also they will improve the strength of the bodily parts. దీని ఉపయోగము కలుగవలనతో కొద్ది నిమిషములు స్నానము చేయుట చాలదు. ఉష్ణోగ్రతను క్రమముగా తగ్గించుతూ స్నానము చేయుచుండుటయు, కొన్ని నిమిషములు మాత్రమే చన్నీటి స్నానము చేసి వచ్చుటయు ఎక్కువ ఉపకరింపవు, ఉపశమనము మాత్రము కలిగించును. ఎట్లయినను వీని ప్రభావము కేవలము భౌతికమే కనుక ఔషధముల విషయమున వలె ప్రతిక్రియా ప్రభావమునందలి కష్ట నష్టములు కలుగునని భయపడనక్కర్లేదు. కరెక్టేనా? So by giving baths only for a few moments, sometimes it is not enough. For some minutes we should give bath, sometimes with the same temperature, sometimes with lowering the temperature we have to continue the bath. Of course these will give only a temporary relief and palliation. Because of these things, because they are not having any medicinal properties and they are not proved as on the healthy human beings as medicine, they will not disturb and they will not give any adverse reactions or effects on the patient. వివరణము. స్నానముల విషయమున హ్యానిమన్ ప్రతిపాదించిన విషయమునకును ఆయుర్వేద శాస్త్రకారులకును కొన్ని భేదములు కనిపిస్తున్నది. Because the master knew, he was well versed with Ayurveda also, he is explaining these things in a wonderful way. He is giving very good explanation. Master E.K. says, there is a difference between the statement of Hahnemann and also according to Ayurvedic. Once Master said, because Hahnemann did not know about Ayurveda, if Hahnemann might have studied Ayurveda also, he would have given much more dimensions of homeopathy. That Master has expressed. అట్లే దేహమునకు ఔషధమును మర్దించటం చెప్పిన తావులందును భేదము ఉన్నది. ఇతని దృష్టిలో స్నానము ముఖ్యమైన వైద్య ప్రక్రియలలో ఒకటి కాదు. అకార్డింగ్ టు హ్యానిమన్, గివింగ్ బాత్ ఈజ్ నాట్ ఇంపార్టెంట్ థింగ్, ఇట్ ఈజ్ ప్రక్రియ కూడా మిక్కిలి స్వల్పము. ఆయుర్వేదమున అభ్యంగనమనున్నది ఆరోగ్య రక్షణమునకు ఆవశ్యకమగు ప్రక్రియ. ఇట్ ఈజ్ ఓన్లీ వన్ థింగ్ అపార్ట్ ఫ్రమ్ ది అదర్ థింగ్స్ అకార్డింగ్ టు హ్యానిమన్. బట్ ఇన్ ఆయుర్వేద, giving bath, a wonderful bath with many herbal oils and sesame oil and all these things, it is a wonderful thing. It is a main part of treatment also according to Ayurveda. దీని వలన మిగిలిన వారికి కలిగిన రోగములు నిత్యాభ్యంగనం చేయువానికి కలుగువనుట అనుభవ సిద్ధము. When a person takes frequently head bath with sesame oil and also with herbal oils and also with herbal powders regularly, at least twice or thrice in a week, it was proved that person will not be affected with the acute affections as frequently as other people who are not taking the bath are getting affected. That is a proved fact, Master says. అంతేకాదు, కన్నులు, ముక్కులు, గొంతుక, చెవులు, శిరస్సులకు చిరకాలము దృఢత్వము నిలిచి ఉండును. So there will not be any frequent illnesses for ENT division. That means ears, nose and throat. When the oil is being used according to Ayurveda, Head will be protected, nose will be protected, ears will be protected, eyes will be protected. They will be strong and they will not get affected very easily with all types of diseases. But according to some of the modern medicine people nowadays, they are advising not to use any oil into the ears. But according to Ayurveda, once in a week, if we put few drops of sesame oil in the ears, there will not be any dryness, there will not be any infection. Nothing will be there. The ears will be protected for a long time. There won't be any hearing defects. And also putting oil to sesame oil 2 or 3 drops in the nose once in a week or once in 10 days. It will help, it protects the person from the blocking of nose and also development of any polyps also, that will be prevented. So these are the things which were advised in Ayurveda. వీనికి కల రోగములు కూడా అభ్యంగన ప్రక్రియతో నశించం. In some chronic diseases, giving a wonderful bath with either sesame oil or ghee, they will act as curative things. They will definitely cure. Not only chronic diseases, but also acute disease. That we have also seen. Master explained us about the experiment of with these things by my grandfather. He used to practice like this. Master has explained. And after that, we have seen in some cases. In one case, he was admitted in the hospital. He was very stout. He was getting fever, continuous fever. There was no response for the treatment in the hospital. They said he will not survive. He became very lean and very much emaciated. They diagnosed it as PUO, pyrexia of unknown origin. They could not understand why this person was getting fever. All the tests were normal, but he was emaciating. He was growing very much weak. He was very stout and healthy. So we took him to the house. They sent him to the house. In the house, we advised them to give a massage with ghee. Ghee. And also we asked him to eat some ghee. Then we gave, we applied ghee to throughout body and also to the head, and gave him head bath and also bath to the body with herbal powder. That day he was better. That weakness was better. After 1 week of giving these baths like this, the temperature was completely normal. And he was able to take food also. After 15 days, he could walk normally in the house. After 15 days again, he went to the hospital because he was working in a government office. So he went to the hospital. Then the doctor surprised, "Are you alive?" He asked. I thought by this time you might have gone. So he was very much surprised. He asked, "What medicine you are taking?" Then he said, "I am continuing homeopathy as well as Ayurvedic bath." Then the doctor was very much surprised. "I heard about Ayurvedic bath, but I am seeing you." Very, very surprising. After 3 weeks, he started going to the office. After that, he survived for more than 25 years normally. Recently, only last year he expired due to the age factor. He was 78 years. Pratap garu. రైల్వే హాస్పిటల్లో వాడు పంపించారు ఇంటికి, ఇంకా బతకడ తీసుకెళ్ళిపోండి అని. ఇదో దీంట్లో ఈ నెయ్యి రాస్తే వాళ్ళు నెయ్యి రాసి స్నానం చేయిస్తే వాళ్ళకి చెమట ద్వారా ఇవన్నీ పోతాయి. ఆఫ్టర్ 60 years of fever, there was a patient when my grandfather was practicing Ayurveda, that is 60 years ago. He was a very good practitioner of Ayurveda with simple things. Only herbal things and also simple things. One lady, she was suffering from double typhoid for 60 days. The temperature was very high for all the days. Though the doctors tried with many medicines, there was no response. She could not get sleep, no sleep at all, even after giving tranquilizer. She was much emaciated, much weakness, and very much anxious. She was weeping, and she could not bear. Then the doctor said, we cannot do anything. We have done all the things what we have to do, but we can't understand why she is not getting relief. Then they said, there is a wonderful person who is practicing Ayurveda. You call him. But you should get prepared. Whatever he says, you have to follow. You should not judge for yourself. We can't understand why he says like that. What he does, that we cannot understand. But you have to follow. Be prepared. Then the family members automatically, they were ready. Because she is going today, we have to see. One chance. Then my grandfather went there. He sat by the bedside of the patient. He asked, why are you like this? What do you want? Why are you not eating anything? Because you are not eating anything, you are not getting sleep. Because you are not eating anything, your temperature is not being controlled. So you have to eat. Then she said, nobody is allowing me to eat. Then he said, I will allow you to eat. What do you want to eat? Then she said, I want one chutney with the spicy things. I want to eat that. Okay. Then she said, okay, I will give you. No worry. Before that, I will tell you something. Then he advised the family members to bring much ghee, cow ghee. They brought the ghee. Then he advised the persons to apply ghee to all over the body, even to the nails of the hands and also toes, and also head completely. And allow the condition for half an hour after applying. Then he said, you take her and give a bath with lukewarm water. They were much afraid. What he is telling? Is he not mad? Because for the last 60 days she is suffering from high fever. He is advising us to take and give her bath. They were very much surprised, but they can't do. They have accepted. Whatever he says, they will follow. So they took her and gave bath, and she came. Then she said, I am feeling comfortable, she said, for the first time. So now do you want to eat? She said, yes. Then he advised to bring hot, very hot rice, and with that pickle. And also he gave this ghee, one big spoon, tablespoon ghee. He gave her. He advised her to eat first. She ate. Afterwards, he advised her, no, you can eat. You can eat this with this pickle. Whatever amount of rice you want to eat, you can eat. What much she can eat? Only 2 mouthfuls she could eat for the first time after 60 days. Then, are you satisfied? He asked her. Yes, I am satisfied. Then he asked her, yeah, you chit-chat something. You tell something. I will hear. Or if you are having any doubts about anything, you ask me, I will clear you. While chit-chatting, after 2 or 3 hours, she said, I am getting much sleep. You can sleep. Then the family members asked, after taking rice, the chronic patient should not sleep. You are allowing her to sleep. Then he said, no worry, let her sleep. She slept, very deep sleep. 4 hours, 5 hours, 6 hours. For 12 hours she slept. The family members lost all the hopes. This might be the permanent sleep, they thought. He said, my grandfather said, no worry, I will sit here. I will not escape from here. Till she wakes up from sleep, I will sit here. Don't worry. After 12 hours, she slept, she woke up from sleep. She said, I am feeling very comfortable. My head is very happy. My mind is very happy, peaceful. Then he advised the members to see the temperature. For the first time, the temperature was 102 Fahrenheit. It was 104 or 105 previously. So 102. Every day he used to go there. He continued the same thing. Then the family members asked, why are you not giving any medicine to her? He said, this is only the medicine I will tell you. You don't advise me. You follow my advice. So for 1 week he continued the same thing, and the temperature was completely normal. And she could sit. She could slowly move in the house. She could eat some more things. After 10 days, she could move normally in the house. After 15 days, she could do all the works in the house. Then only he gave some general tonic, Vojini, which he was preparing. That tonic he gave. Apart from ghee and that tonic, he did not give any medicine for this 60 days fever fellow. స్నానం కంప్లీట్ నెయ్యి పూర్తిగా రాయడం స్నానం డైలీ వారం రోజులు చేసరికి నార్మల్గా వచ్చింది. ఆవిడ ఓ రోజు 2 రోజులు ఆవకాయ తింది. తర్వాత నుంచి ఈయన ఏం చెబితే తినేది కూరలో విను. తాతగా సివివి గారు, రామకోట తాత గారు వీళ్ళందరూ ఏది పడదో అది ముందే వేసుకోమనేవారు. మిమ్మల్ని డాక్టర్లు ఏది తినొద్దున్నారో దాంతోనే తినండి అనేవారు. పక్కన కూర్చోబెట్టుకుని ఆయన రామకోట తాత గారి దగ్గరికి ఒక ఆయన వచ్చారు అమలాపురంలో. ఏమండి ఇప్పుడు నేను 3 సంవత్సరాల నుంచి గ్యాస్ట్రిక్ ట్రబుల్తో బాధపడుతున్నాను. అవును బాబు గారు, అది గ్యాస్ట్రిక్ అన్నారు ఈయన. అంటే ఏదో ఈయనకి సమంగా వినబడలేదు, ముసలాయన అనుకుని మళ్ళీ ఆయన చెప్పాడు గ్యాస్ట్రిక్ ట్రబుల్ అండి అన్నాడు గట్టిగా. అంటే ఈయన అవునండి గ్యాస్ ట్రిక్ అన్నారు. అంటే ఏం తింటున్నారు అన్నారు. ఏం తింటాం లేదండి. ఏం తినొద్దన్నారు, పులుపు కారం అసలు ఏం తినొద్దన్నారు, ఆవకాయ తింటే చస్తామన్నారు అన్నారు. అలాగా పెద్ద డాక్టర్లు అందరూ చెప్పారా, ఇది రూఢిగా అన్నారు అని చెప్పారు. అయితే పర్వాలేదు కూర్చోండి నా పక్కన, ఇవాళ ఆవకాయతోనే తినండి అన్నారు. అవకాశం వచ్చినట్టు సంతోషంగానూ ఉంది, తింటే ఏమవుతుందో అన్న భయం ఉంది. తిన్నాడు శుభ్రంగా ఆవకాయతో ఆయన పక్కన తాతగారి పక్కన కూర్చొని తిన్నాడు శుభ్రంగా. ఏమీ అవ్వలేదు. మర్నాడు నుంచి తగ్గడం మొదలుపెట్టింది. 1 వారం అయ్యేసరికి కంప్లీట్గా తగ్గిపోయింది. ఏం తిన్నా ఏమవటం లేదు అప్పటి నుంచి. So in Ayurveda, these baths, they have much importance in curative factor. They work as medicinal agents. That master is explaining here. B. He used to advise to use 2 items. One is ghee, another is sesame oil. నువ్వుల నూనె నెయ్యి ఆ రెండింటితో. బి. తీవ్ర జ్వరాదులలో ఆయుర్వేదమున కేవల స్నానమే ఒక చక్కని వైద్య ప్రక్రియ. ఇన్ సివియర్ ఫీవర్, these various types of baths, they will act as curative factors and medicinal agents in the way in which I have explained now. తీవ్ర జ్వరముతో బాధపడువానికి అది ఏ జాతి జ్వరమైనను దేహమునకు నువ్వుల నూనె రాచి 1 చెంచా పేరిన నేతిని తినిపించి గ్లాసుడు వేడి నీళ్లు త్రాగించి వేడి నీటి స్నానము చేయించినతో చికిత్సలో చక్కని సారూప్యము సిద్ధించుచు జ్వరము తగ్గుట మాత్రమే గాక వ్యాధి మొత్తము నివారణ. In chronic fevers also, in acute fevers also, we have to apply this sesame oil, and also we should give the person to eat some ghee, and also with lukewarm water. If we should ask him to, after taking ghee, we should ask him to take some lukewarm water to drink, and later we have to give bath with lukewarm water. That is a similar application of similarity. That will definitely cure the condition. జ్వరము తగ్గుట మాత్రమే గాక మొత్తము వ్యాధి నివారణ మగును. టైఫాయిడ్, న్యూమోనియాలతో కూడిన తీవ్ర జ్వర వ్యాధులు, డెలీరియము, సంధి లక్షణములతో కూడిన ఈ అభ్యంగన ప్రక్రియతో నివారణ మగును. అక్కడ ఏదో మిస్ అయింది. అది సరే, ఇక్కడ సంధి లక్షణములతో కూడినవి కదా. అదే డెలీరియము సంధి లక్షణములతో కూడినవి ఈ అభ్యంగన ప్రక్రియతో నివారణమగునను విషయమున వందల కొలది ఉదాహరణములను మా తండ్రి గారి వైద్యమును మేమెరుగుదు. సో మాస్టర్ హీ ఈజ్ ఎక్స్ప్లెయినింగ్, I know many hundreds of cases which were treated by my father with these two things, many types of fever, delirium, fevers which are having a delirium, typhoid, pneumonia, all these things, with this type of giving a bath with these things, they were completely cured. I have seen many hundreds of cases which were treated by my father. That master is explaining. In the same way, we have seen when master has cured these cases, types of cases, we have seen many cases. See, ఔషధమును తైలముల ఘృణముల రూపమున ఘృతముల రూపన మాలీసునకును అభ్యంగనమునకును వాడుట ఆయుర్వేదమందలి వివిధ వ్యాధి చికిత్సల ప్రత్యేక పద్ధతులలో ఒకటి. ఇన్ ది సేమ్ వే మెడిసినల్ ఏజెంట్స్, medicinal substances, herbal medicines, and the triturations, and also the juices of herbs, they are made as the ghees, various types of ghees, and by massaging with those ghees also, they helped very much to cure many diseases, and this is also one of the process in Ayurveda. D. స్నానము, దంతధావనము, తైలమర్దనము, అంజనము మున్నగు అంశములన్నీయు ఆయుర్వేదమున ఆరోగ్యవంతుని దినచర్య కొరకు సవిశేషముగా శాసింపబడింది. సో ఇన్ డైలీ రొటీన్ ఆయుర్వేదిక్ seers, they have advised the persons, human beings, to have a regular bath, and also to brushing with herbal things, and also applying oil to the body. All these things in Ayurvedic seers, they have advised the persons, human beings, to follow daily. With their advice only, it was regularized for the person. What happens if we use menthol paste? What happens? The teeth, they get very frequently, and at early age they get spoiled when we use menthol things for the brushing. If we use herbal powders, or if we brush with the sticks of neem tree, then the teeth will be protected from getting decay, and also the gums will be strong for long time. My grandfather, he used to brush it till his last breath, last day. He used only the neem sticks, nothing else. Early in the morning, he used to wake up at 3:30. He used to chew completely the neem stick. It has turned like a brush. With that only, he used to completely brush. And also, after completing the brushing, he used to cut the stick into two. With that, he used to clean the tongue. No tongue cleaners. At the age of 84, he left his body at 84 years. At that time also, his teeth were very strong. Only due to falling, he lost 2 teeth. Remaining all the teeth, 32 teeth, 30 teeth were completely normal, healthy, no decay, and no shaking. Yeah, the teeth of Master E.K. and gums, they were very strong. He was using regularly only herbal tooth powder. With that herbal tooth powder, which he advised to use, and the formula was given by Master E.K. only. With that, not only he advised to use for brushing, but with that, Master has done many experiments with that tooth powder. We went to some pilgrimage once upon a time in 82. There, Master was affected with pneumonia. We were not having medicines. We did not carry the medicinal box with us. There was no emergency kit with us. So then Master advised, you bring the tooth powder, you put it in the water, you boil it. Completely after boiling, you filter it. So after filtering that water, after cooling, then he used to swallow that water. He used to drink that water. Daily 3 times he did like that. In 3 days, the pneumonia was completely cured. Temperature was normal, and then we have traveled to Visakhapatnam in 1982. కానుగా మర్రి ఊడలు, తర్వాత రాగి, తర్వాత వేప, ఇవన్నీ ఉత్తరేణు. ఇంకా ఇంకోటి కూడా చెప్పారు, పళ్ళు కనుక ఊడాలంటే కూడా డెంటిస్ట్ దగ్గరికి వెళ్ళక్కర్లేదన్నారు మ్యాథ్స్ గారు. ఈ అదేంటి మన సీతాఫలం తాలూకు ఎండు పుల్ల తీసుకుని పౌడర్ చేసి అది ఒక గుడ్డలో పెట్టి దాన్ని కొంచెం వెచ్చ చేసి ఒక గుడ్డలో పెట్టి తడి చేసి ఏ పన్ను ఊడాలో ఆ జాగ్రత్తగా ఆ పన్ను మొదట్లో పెట్టమన్నారు రోజు కొంతసేపు, మిగతా పళ్ళకి తగలకుండా. కొద్ది రోజులు ఆ పన్ను ఊడిపోతుంది అన్నారు. తగిలితే అది ఊడిపోతుంది. అందలి ఆచారకాండ పాటించువానికి తరతరముల వ్యాధులు నివారణమగుట అనుభవమునకు సరిపడుతున్నది. అంతేగాక చనిపోవు క్షణము వరకును ఏ వ్యాధియు సోకకుండుట కూడా నేటికినే అవలంబించిన వారి యందు కనిపిస్తుంది. Even today, when who follow these types of Ayurvedic methods in their daily routine and daily life, it is not a surprising thing that they are completely healthy till their last day of breath, without any chronic diseases or any horrible diseases. హోమియోపతి సిద్ధాంతము నా వ్యాధి నిర్మూలనము, ముఖ్యముగా సోరా నిర్మూలనము మానవ జాతికి ప్రసాదించబడినది. కానీ మరల సోరా సోకకుండుటకు కావలసిన మార్గమునకు ఈ శాస్త్రమునందు అవకాశము లేదు. దాని కొరకై ఆయుర్వేద విధానమును ఆశ్రయింపక తప్పదు. Hahnemann has given wonderful thing and very new dimension. Nobody could give the treatment of miasms and the cure of miasms, the cure of sora. When sora is completely cured means no diseases will be there. It was completely explained. He could give, he could achieve wonderful things. But again, re-attack of sora cannot be prevented only with homeopathy. We have to follow Ayurveda also. Cure of sora and cure of miasms will be there with homeopathy. But again, re-attack cannot be prevented with homeopathy. With Ayurveda, we have to club it. That master has explained. Now we will go through Kant's philosophy, lectures on Kant's philosophy. We are reading susceptibility chapter. Now here we might ask the question, when does a medicine that has been administered cease to be homeopathic? The same principle as to susceptibility must apply because of the similarity between cure and contagion. Let me illustrate it in this way. Suppose we have a case of diphtheria, and after due study, lachesis appears to be the most similar of all medicines, and a dose is given. Now, when does lachesis cease to be homeopathic? When the symptoms that indicate it change, then it is no longer indicated. So, as long as the totality is indicates lachesis, then only lachesis will cure. When the totality is completely changed and when it is not similar to lachesis, lachesis will not help. We should not think that lachesis will cure diphtheria. Only when it is lachesis diphtheria, lachesis will cure. That we should remember. If it is given at all after this change, it operates upon a different plane from what it did in its homeopathicity, and if it acts at all, it does not act curatively but depressingly. Even after changing the totality of lachesis, even then if we administer, it will act in another plane. It will not act as a curative agent, but it will if we repeat unnecessarily, it will give its own other symptoms and other dangerous things. We should remember that lachesis is one of the remedies which should not be repeated often. It should be repeated with very long gap. If you give China to a patient, suppose we have given China 30 or China 200 in one case for fever. Next day, if it is needed, we can repeat China 200. But if we have given Lexus 200, next day we cannot repeat Lexus. We have to wait. There are some remedies. For them, for those to repeat those remedies, we have to think of. For example, in a cholera case, we have given camphor. Camphor 30 we have given. There was much improvement. Again, there is a relapse. We can give camphor 30 another dose, even within half an hour or 1 hour. Or we can go to 200. In another case, we have given phosphorus 200. We should not repeat in half an hour or 1 hour. There will not be any necessity. If it is a phosphorus case, definitely it will be cured with 1 dose. We have given arsenic 200. We should not repeat arsenic in half an hour or 1 hour. If we have given podophyllum, if necessary, you can repeat. Like that, we have to study the depth and also the nature of the remedies in repetition. Any more than just enough to supply the susceptibility is a surplus and is dangerous. In a chronic disease, administer sulfur when it is clearly indicated and the symptoms disappear and the patient feels better. Then the remedy ceases to be homeopathic, and if it is administered longer, whatever action it has is neither homeopathic nor desirable. If it is indicated, if we give sulfur, definitely there will be very good improvement. When sulfur ceases to be homeopathic to that case, when it is not similar, when it is not ceases to be homeopathic, what he is using, Kant is using, when it ceases to be homeopathic to that case, that means when the totality has changed. The next totality, if it is not similar to sulfur, sulfur should not be given. It will not act, and apart from that, it is giving too many doses is not desirable when it is not indicated. Chala dangerous, sir. Sulfur 30 పొద్దున డోసు రాత్రి డోసు వేసుకోండి అంటూ ఉంటారు. స్వైన్ ఫ్లూకి ఆర్సనిక్ ఆల్బమ్, అలాగే ఈ బ్రెయిన్ ఫీవర్కి బెలడోనా, కొన్నాడు బీసీటీ ఇచ్చారుగా. బీసీటీ అంటే బెల్డోనా డైలీ పొద్దున రాత్రి అలా ఒక వారం, తర్వాత 1M, తర్వాత 15 రోజులు బ్యాక్ క్యాల్కేరియా కార్బ్ ఒక డైలీ మార్నింగ్ ఈవినింగ్, ఆ తర్వాత ఇంకో 15 రోజులు బ్యాక్ ట్యూబర్క్యులిన్. then it will be clear. అంటే అసలు ఇంకా ఇండికేటర్ అలా కాదు అది డిఫరెంట్. ఇప్పుడు కాన్స్టిట్యూషనల్ డ్రగ్ బై బర్త్ కొంతమందికి లక్కీగా ఒకే కాన్స్టిట్యూషనల్ డ్రగ్ ఉంటుంది. అది మేష్ గారు కొన్ని కేసుల్లో చేశారు. అంతకుముందు అలా మంచి హోమియోపతి మేష్ గారు కూడా కొన్ని ఎగ్జాంపుల్స్ చెప్పారు. కొంతమంది వాళ్ళు ఒక 10 ఏళ్ళో 15 ఏళ్ళో కేసు ట్రీట్ చేశాక వాళ్ళకి రాసి ఇచ్చేసారు, మీ కాన్స్టిట్యూషనల్ డ్రగ్ ఇది, మీకు ఏదొచ్చినా ఇది వేసుకోండి, డోస్ తగ్గుతుందంటే. ఆ తర్వాత 30-40 ఇయర్స్ వరకు కూడా వాళ్ళు అది యూజ్ చేసుకుని ఇంకే డిసీజెస్ రాకుండా కూడా అలా ఉన్నవాళ్ళు ఉన్నారు. నాకు తెలుసు కేసులు ఉన్నారు. మేష్ గారు ఒక 2-3 హోమియోపతిక్ డాక్టర్, వాడికి తెలియదుగా సిమ్టమ్స్ చూసుకోవడానికి. వాడు హోమియోపతిక్ డాక్టర్ కాదు, కానీ ఈయన ఎంత ఆథెంటిక్ అంటే ఇచ్చిన డాక్టర్ డెఫినెట్గా వీడి కాన్స్టిట్యూషనల్ రెమెడీ ఇది కాబట్టి అది పనిచేస్తుంది. ఆయన ఏం చెప్పాడంటే టూ మెనీ డోసెస్ చెప్పలే, ఆయన రాసిచ్చేసి నీకు ఏదైనా సిమ్టమ్స్ వస్తే ఒక డోస్ వేసుకో, తగ్గిపోతుంది, తగ్గకపోతే వేరే డాక్టర్ దగ్గరికి వెళ్ళు అని చెప్పేది గట్టి ఇన్స్ట్రక్షన్స్ ఇచ్చారు. అలాగ మేష్ గారు ఇచ్చిన కొంతమంది మేష్ గారి దగ్గర 15 ఏళ్ళు 20 ఏళ్ళు మందులు తీసుకున్న వాళ్ళు బుక్స్ జాగ్రత్తగా పెట్టుకున్నారు. పెట్టుకుని ఏ సిచ్యువేషన్లో మాస్టర్ గారు ఏ డ్రగ్ వేశారు చూసుకుని ఆ సిచ్యువేషన్ వచ్చినప్పుడు అదే డ్రగ్ వేసుకుంటే వాళ్ళకి అన్ని తగ్గుతూ ఉంటాయి. ఇప్పటికీ చేస్తున్నారు కొంతమంది జాగ్రత్తగా పెట్టుకుని. అలా కొంతమందికి మాస్టర్ గారు కాన్స్టిట్యూషనల్ డ్రగ్స్ కూడా చెప్పారు. అది లక్కీగా ఏంటంటే త్రూ అవుట్ అదే కాన్స్టిట్యూషనల్ డ్రగ్ ఇండికేట్ అయితే వాడు ఫార్చునేట్, వాడికి ఏది వచ్చినా అది వేయచ్చు. అంటే వాడికి టోటాలిటీ మారిపోయి అదేగా చెబుతున్నాడు, టోటాలిటీ మారిపోయి అప్పుడు ఎక్యూట్లో కానీ క్రానిక్లో కానీ నువ్వు మందిస్తున్నప్పుడు టోటాలిటీ మారిపోయింది అనుకో, అదే డ్రగ్ వేస్తే పని చేయదు. తర్వాత పొరపాటున ఒక డోస్ వేసామనుకో పర్వాలే, ఇదే వీడికి మొదటి నుంచి పని చేసింది కదా, చాలా క్యూర్ అయింది కదా, నువ్వు రిపీట్ చేస్తావు అనుకో హారం చేస్తుంది. అది ఏం చెప్తున్నాను. ఎందుకంటే మయాజ్మేటిక్ ట్రీట్మెంట్లో చాలా ఇంపార్టెంట్. ఇన్ ది ట్రీట్మెంట్ ఆఫ్ మయాజమ్స్ it is very very important to judge upon the action of the remedy whether it should be repeated or next potency should be given, or whether the drug should be changed or the following remedy should be given. The remedies that follow this remedy that should be given sometimes. For example, in the chronic psoric cases, sometimes after relief to some extent after calcarea carb, there will be a need to give lycopodium which follows calcarea carb very well. That means in each and every case calcarea and lycopodium should not be given for after calcarea carb. Some people they use for psora miasm, first they will give sulfur, then calcarea carb, then lycopodium. Again sulfur, calcarea carb, lycopodium. It was not advised either by Hahnemann or Kent or Master. You should not give like that. Though he has given as psoric trio means these are the important remedies that you should think of while curing the psora miasm. That only for easy purpose he has given, but he did not advise to use like that to administer. But man argues, if a little will do good, more will do more good. Generally what the human being thinks is, when one dose has worked well, if we use more doses, more good will be there. Normally we the human beings think like that. That Kant is explaining. Enough to effect a change is all that can be homeopathic. When certain changes are affected, then the physician must wait. The physician must wait. That a remedy is given, there are definitely improvement, and there are some changes in the vital things and important things, then he should wait for some time. Enough medicine must be given to establish order, and that is done almost instantaneously. At most it is but a matter of a few hours, and as long as order continues after it has once begun, so long hands off. So when the improvement starts, either in acute or chronic diseases, sometimes in chronic diseases also the improvement starts immediately. If the person is a sensitive person, the remedy will act immediately. The action of the remedy will act immediately. And also if the given remedy is also a sensitive remedy, that means if we gave ignitia, its action will start immediately. If the person is sensitive, it will start definitely immediately. If we have given opium, so the action may start very slowly, because the nature of the remedy is slow. And the chronic opium patient is also very dull and slow. For him also the action will start sometimes slow. We have given opium 1 m. Immediately. In acute diseases, immediate action will be there even with opium. Yes, immediately. But in chronic cases, I am telling, Sometimes it is not hard and fast rule, but sometimes it will happen in chronic cases. So, as long as order continues after it has once begun, so long hands off.
Keep your hands off.
That is just the way contagion takes place. In diphtheria, the disease begins, susceptibility ceases, a change takes place that protects the man from any further disease cause flowing into the body, and the disease develops and manifests itself by its symptoms. The disease itself, it will not allow any other disease to affect the person. The repetition of dose is advised by many wise heads, but but if we understand this doctrine, it will be clear to us that such repetition of dose is perfectly useless. When the action started, suppose one person is suffering from 104 temperature, 104 degrees of Fahrenheit. When we have given one medicine, for example, we have given bacillinum 1M, the action has started. The person is getting, there is improvement in cold and cough. There is improvement in chest congestion. There is improvement in the weakness. But the temperature is like that. Even after 4 hours of giving bacillin, the temperature did not control. Then we should not think that we have to give another dose of bacillin 1M. Recently, I have seen one doctor, he has given bacillin 1M 3 doses in 24 hours. Because the temperature is 104, after giving bacillin, there was improvement. The temperature has come down to 100. But by evening, again, by night, again the temperature shot to 104. Immediately, the doctor has given bacillin 1M another dose. Morning 1 dose, night 1 dose. Next day, by next day morning, the temperature came down to again 100. By afternoon, again it shot. Another dose he has administered in the afternoon. Then they have phoned me. I advised them not to give any other medicine except you give ferrum phos 6x, Calimur 6x and natrum sulf 6x. You dissolve them in water. For every 2 hours, you give 2 spoons of that water. Then they have much worried. The temperature is now also 104. I said, no worry, nothing will be there. Whenever you feel much fear, you phone me, no problem. I will answer you. Maintaining upon this for 24 hours, there was completely normal. Fever was normal, no recurrence, and the patient was better. Chest congestion, everything was normal. So the remaining 2 doses are useless. 1 dose of bacillin, when it is indicated, definitely it will cure. But sometimes in some cases, in one case I have seen, one small boy of 1 year. Last year we had treated that boy. He was getting 104, 105, 106 temperature. I have given bacillin 10M. For one next day, there was the temperature completely subsided and he was better for 1 week. Again started. Again it was 106. So again I have given bacillin 10M. There was no improvement. Within 12 hours I had to give bacillin 50M to that boy. Then he got improvement. Till up to 1 year he did not get any fever. Recently also 2 days back they have found that he is getting again fever. But within 12 hours I had to give 50M after giving 10M. But in some cases we have to judge. We should not repeat when there is improvement, we have to wait, that he is telling. రోజు 108 వచ్చేది, రోజు సాయంత్రం 108. బ్యాచులర్ 50 వేసాక తగ్గింది కదా, తర్వాత లైకోపోడియం వేసినట్టు గుర్తు అది. 3 years 4 years అయినట్టుంది కదా, 2 years అయింది. ఏదైనా ఓపీఎం 1 వేయాల్సి వస్తుంది ఒక్కొక్క కేసులో. ఫీవర్లో బాగా హై ఫీవర్ ఉండి ఇంకా 104, 105, 106 వస్తాయి టెంపరేచర్. అక్కడ బాగా మత్తుగా ఉంటాడు, చూస్తే అంత టెంపరేచర్ ఉన్నా బాగా చెమటలు పట్టేస్తూ ఉంటాయి. మొహం మీద నుదుటి మీద చూస్తే ఒళ్ళంతా పట్టవు, అక్కడే పడతాయి. అయినట్టు అంత మామూలుగా అంత టెంపరేచర్ అంత చెమటలు పడితే టెంపరేచర్ తగ్గదు. అంతా చూస్తే వాడికి స్వెట్స్ విల్ నాట్ ఇంప్రూవ్, డిక్రీజ్ ది టెంపరేచర్ అనేటువంటిది. హాట్ స్వెట్స్ అపాన్ ది హెడ్, ఫేస్, తర్వాత డ్రౌజీనెస్, అవన్నీ కూడా చూస్తే ఓపీఎం సరిపోయి. కానీ అక్కడ టెంపరేచర్ 106 ఉంది, ఓపీఎం 200 వేసి కూడా అలాగే ఉంటాడు, వాడేం రెస్పాన్స్ ఇవ్వడు. అంచేత అక్కడ కనీసం ఓపీఎం 1 ml 10 ml వేసేస్తే వెంటనే తగ్గుతుంది. కానీ అదే కేసు, అలాంటి కేసే బాగా టెంపరేచర్ ఉండి 104, 105 ఉంటుంది, ఒళ్ళంతా చెమటలు పట్టేస్తాయి, చల్లగా ఉంటుంది ఒళ్ళు. ఈ ఓపీఎం వాడికి వేడిగా ఉంటుంది. ఇంకో కేసులో చల్లగా ఉంటుంది, ఒళ్ళు చల్లగానే ఉంటుంది. చూస్తే మోసపోతాను టెంపరేచర్ అంత ఉందా అని. థర్మామీటర్తో చూస్తే 105 ఉంటుంది, వాడికి ఒళ్ళంతా చెమటలు పోస్తాయి. ఆ చెమటలు పోస్తే టెంపరేచర్ తగ్గిందేమో అనుకుంటాం, తగ్గదు. థర్మామీటర్తో చూస్తే అంతే ఉంటుంది. డల్గా ఉంటాడు, ఆకలి ఉండదు, ఏమైనా తినమంటే వికారం ఉంటాడు, అలా పడుకుని ఉంటాడు, నీరసంగా ఉంటాడు. అటువంటి వాడికి మెర్క్సాల్ వేస్తే తగ్గుతుంది. మెర్క్సాల్ 200 వేస్తే చాలు. వాడికి మెర్క్సాల్ 10 వేయకూడదు. It is true that in vigorous, robust subjects who have lightning-like reaction, the dose may be repeated and changes occur for the better if the remedy is not quite homeopathic to the case. But some are injured in this way. Frequent repetition of the remedies in robust persons, even unnecessary repetition also will not harm much, because his vital force is very bad, very much good. But some are injured in this way because they are delicate subjects whose reaction is slow. The reaction is actually prevented by the repetition of the dose. That is, the order we have tried to establish is actually prevented. Though the remedy is the administered remedy is exactly correct and it is similar, if we leave after giving one dose, definitely the improvement will start. But by repeating the second and third dose, they themselves will prevent the improvement. That he is explaining. We cannot understand why there is no improvement. Even though we have given the similar remedy and the similar potency, why the patient is not getting improvement means your repetition is spoiling the case. The second, when the second dose or third dose is being given without any necessity, that second dose or third dose will prevent the reaction, will prevent the cure. It will not allow. That he is explaining. Hahnemann teaches that the human economy is more under control of man than under the control of disease, for the economy can be affected only by such disease as it is susceptible to, but man, whether for the purpose of proving or for the purpose of curing, can so vary the dose that he can always get results, and the very susceptible ones are terribly damaged by the repetition of the dose. From the natural disease, it takes its own course. We cannot stop without giving any medicine. But the drug disease, we can judge. We can give more strength or less strength. That we can decide. With this repetition of the dose, when the person is very weak, that will spoil the case. See how wonderfully he is explained. Now lesser writings by Kent. Wait and observe. Wait and observe. That chapter we are going to read. The first prescription may not have been well chosen medicines, and then it becomes necessary to make a second effort. When we have given the first prescription after studying the totality, when there is no improvement, then how we have to give second prescription. As time brings about the re-examination of the patient, new facts are brought out in relation to the image of the sickness, indicating that the first medicine has not been suitable. Perhaps several weeks have passed and the re-examination finds no change in its symptoms. So after taking up the case, after studying in a well manner, we have administered some dose. For example, we have given Naxomica 1 m to one patient. Even after waiting for 4 weeks or 6 weeks or 2 months, there is no improvement at all, even a single symptom. Even the vitals are not improved. Then we have to restudy the case. That means in restudy and in re-questioning of the patient, some more facts will come out which were not explained by him in first sitting. So basing upon them, we have to decide. Shall I compare all the facts in the case to reassure myself of the correctness of the first prescription, or shall I wait longer? To whether I have to change the medicine or still I have to wait, that we have to decide. Yes, to the former, of course, and if the remedy is still the more similar to all the symptoms, wait and watch and study the patient for a new light on his feelings, to which he has become so accustomed he has not observed. Even after some time, when there is no change, when the patient reports no change at all, then you have to think whether still the remedy is similar, the original remedy is similar to him or not. If it is similar, what is happening, that you have to know. There may be another alternative that he is explaining. The patient might have accustomed to all these symptoms since so many months or years. So he is unable to know or observe the changes. See, very subtle points is explained. Huh? Huh?
Some families, they are they belong to a business class. They think that if there is no change.
In hypochondriacs, the patient will feel that with first prescription itself, all the things should disappear. So he explains there is no change because there are symptoms. We have to slowly put them in conversation. We have to slowly divert the mind, and we should make them think of whether there is any little change or not. What is the observation? That we have to train them. Commonly, the new study of the case will reveal the reason why the first prescription has not cured. It was not appropriate. If it still appears to be the most similar remedy, the question arises, how long shall I wait? If this remedy is still similar, then we have to question ourselves, how long we have to wait. At this point, it should be duly appreciated that the length of time is not so important as being on the safe side, and wait is the only safe thing to do. It may have been many days, but that matters not. Wait longer. Even after 7 days of giving the medicine, there is no change. Still you have to wait. Even after 15 days, no change. You have to wait. The patient may be anxious that he should get improvement within 1 week or within 2 days, he should get improvement. Sometimes there will be some more expressions will be there. The patient may tell you after third or fourth time coming, the first medicine which you have given, that was wonderfully, there was improvement. The second medicine you have changed, there is no improvement. Then we have to think whether we have changed medicine or not. What we have changed is, in the first prescription, we have given round pills. In the second prescription, we have given tablets, tissue salts. So with that first treatment, that round pills, I got improvement. With the tablets which you have given in second prescription, there is no improvement, they will tell you. That you have to understand. The language of the patient you should understand. So third time again you give round pills. Definitely next time they will tell you improvement. So what they are telling, that we have to, especially in village, not only in village people, in city people also, but especially in village people, they remember the shape of the remedies with which they got very good improvement, they will remember. If the doctor changes that, immediately they will bring. No, you have changed the medicine. Not only the whole medicine, but if we have given biochemical remedies at night and round pills with mother tinctures in the morning, and in next prescription we change biochemical to morning and round pills to the night also, they will bring the medicine. No, you have changed the medicine, they will tell you. So all these things are there. These things we have to study. The finest curative action I ever observed was begun 60 days after the administration of the single dose. After 60 days only the action has started after giving the dose. This is possible in a chronic cases, not acute cases. That was the curative action may begin yes, as late as a long-acting drug can produce symptoms on a healthy body. This guide has never been thought of by our writers, but it is well to be considered. Why not? It is the practice for some to go lower if a higher potency has failed. This method has but a few recorded successes, but should not be ignored. When one remedy is being given in higher potency, some people they give the same potency immediately in lower potency. Same remedy in lower potency. That should not be done. But in rare cases, it helps. వేయకుండా కూడా కొన్ని కేసుల్లో అది the method has but few recorded successes, but should not be ignored. There are only few cases which got improvement in that method, but not in all. But we should think of whether if this person may come to that few cases, that we have to think of. The question next to be considered is the giving of a dose of medicine in water and divided doses. This has at times seemed to have favor over the single dry dose. If we give one dose, sometimes it may not act in some cases. We have to dissolve in water. This is in some chronic cases and also in acute cases. We have to dissolve this in water, in a cup of water, the same medicine. We have to give 2 spoons to the patient, and you add 2 spoons of water to this. That also sometimes, in some cases, it will help. This is open for a discussion, requiring a testimony of the many, not a few, to give weight. The best reports are made from both methods, and both are in harmony with correct practice. The lesser ratings of Hahnemann now. more particular directions is the chapter. The police officials ought to ascertain where any person has been suddenly taken ill in the town or has suddenly complained of headache, rigor, stupefaction, or has rapidly become very weak and delirious. They should report what they learn to the appointed physician, who, after a rapid but careful examination, during which he attends to the directions below for avoiding infection, sees that the patient is conveyed to the hospital. At the same time, the police officer receives his fixed remuneration. If this remuneration be considerable, about a thaler, for the discovery of every case of this kind, the progress of the epidemic will be speedily checked. There will soon be no more sick to be separated from the healthy. The sick will be discovered in time before they can easily communicate to the infection. Again, in human life and in the smaller sum required will be the manifest result. The large hall of the hospital should be divided longitudinally by means of a partition of boards. The one part so divided to form the patient's ward, whilst the other and much narrower division forms a kind of passage into which the bedstead of each patient, which should be placed on casters, may be pushed through a trap door into the partition in such a manner as that the only patient in the bed shall come into the passage, whereon the trapdoor falls to again. Here the physician examines the external and internal condition of the patient in the presence of the surgeon. Then he causes him to be pushed back into the ward and the next patient to be brought forward, and so on. One patient, that infected patient, should be examined one by one, not in common hall, that he is telling. But before performing this examination, and indeed before the arrival of the physician, all the windows of the passage should be opened in order to air it. Before the patients are brought in, they must be closed. So before the patient, the fresh air and air circulation should be there. But just before bringing the patient, they should be closed. The physician, accompanied by the surgeon, both covered with oilcloth, visits the patients twice a day and questions them at a distance of 3 paces. When the disease is particularly malignant in its character, it is advisable to have a hood attached to the cloak, which the medical officer may draw over his head when he makes his visit, for it has been observed that the contagious matters attach themselves most readily to wool and hair. If he require to feel their pulse, he must do this with averted head, and immediately afterwards wash his hand in a basin containing water and vinegar. If the patient's face be directed towards the light, it is not difficult to observe the state of the tongue at a distance of 3 paces. At a less distance, it is scarcely possible to avoid the danger of inhaling the patient's breath, whence the contagious principle spreads farthest and most powerfully. He is explaining the contagious diseases, which are very dangerous. Malignant contagious. Contagious వాటిలో malignant fevers అవన్నీ వస్తాయి కదా కొన్నిట్లో వాటివి. The odor of the contagious miasm of malignant typhus fever is a kind of earthy, mouldy smell like that from old graves newly opened. It has little or no resemblance to the odor of the putrid flesh. ఎంత ఎంత జాగ్రత్తలు తీసుకోమంటున్నాడో అసలు. అంటే తప్పనిసరైన వాటిల్లో ఎలా తీసుకోవాలో డాక్టర్ వాళ్ళు ఎలా అప్రోచ్ అవ్వాలో వాటి దగ్గర నుంచి అంత జాగ్రత్తగా ఎక్స్ప్లెయిన్ చేస్తున్నారు. క్లినికల్ మెటీరియా మెడికా బై ఫ్యారింగ్టన్. We are reading about Musk. Musk and Asafoetida agree in producing a globus hysterical, spasms of the chest and palpitation. The former is best adapted to a full-fledged hysterical spasm with fainting or unconsciousness. The latter has more offensive discharges, and the globus is part of an extensive reverse peristalsis. Fainting has not been noted except in one case when the intensity of the pain caused it. Tympani is also well marked. Magnesia muriatica resembles the last remedy and also musk. Like other magnesia preparations, it affects the stomach and bowels and the nervous system. Thus, the carbonate and phosphate are indicated in neuralgia, especially in cases subject to repeated attacks by reason of nervous debility. The muriate, however, has been proved to be eminently useful in hysteria. Magnesia more anamata. Magnesia carbo, magnesia phos, neuralgias, they will do wonderful things. In one case, I have treated with magnesia carbo. There was one wonderful improvement in facial neuralgia. He was getting very severe attacks. There was no improvement with other remedies. Only after giving magnesia carb, he got very good improvement. We observe prominent abdominal symptoms: nausea with accumulation of water in the mouth, liver enlarged, tongue large, flabby and yellow. She must hurry to stool, which is crumbly as if burnt, and as if to show a combination of abdominal and nervous symptoms. There are rumbling in the abdomen with dragging, gripping, cutting, tension, and then pain, as if the bowels were cut to pieces. Feeling of something rising into the throat like a ball, almost taking her breath. Relieved by erections. Flatus collects in the stomach and abdomen, causing reflex spasmodic symptoms through irritated nerves. This is still further confirmed by the following: attack of faintness during dinner, anxiety with nausea and pale face, trembling of the body, relieved by erections, or again sudden heaviness on the chest during dinner, nausea, water in the mouth, heat mounting to the face. It seems as if erections or vomiting would relieve her. Illustrations of fancy have been observed. Very important is the headache, gripping and raging in the both temples, sensation as though she would become dizzy and lose consciousness, disappearing on pressing the head with both hands. Headache relieved by wrapping up the head. The menstrual flow is black, clotted, with pains in the back while walking and in the thighs when sitting. Uterine spasms with tension in the groins. Hail things in the broad ligaments. Cutting in the lower abdomen during menses. Cramps in the abdomen with pressure upon the rectum and genitals. Palpitation of the heart, not as in musk, as from anxious expectation, but nevertheless non-organic, or it comes on while sitting and on rising from a seat and disappears on moving about. ఇందాక లాస్ట్ కొత్త కేసు చూసాం కదా, ఇలాంటిదేగా. Palpitation of heart. This has been several times confirmed. Briefly, by way of a summary, Moschus excited, scolding, fainting, coldness, spasm of the glottis and lungs. Castoreum exhausted, pains better from pressure, menstrual colic with pallor and cold sweat. Naximoscheta, errors of perception, drowsy, faints, enormous tympany, oppression of the heart and throat, skin dry, cool, Valeriana, nerves irritated, cannot keep still, tearings, cramps, better while moving, taste of tallow or slime. Asafoetida, reverse peristalsis, rancid erectations, offensive flatus, tightness of the chest, checked discharges. Magnesia muriatica, faints at dinner, relief from erectations, head better from pressure and wrapping up, palpitation better on moving about, stools crumble. Moscus has been employed by allopathic physicians when in the course of pneumonia a purely nervous delirium obtains. The brain is violently excited and the patient talks nonsense with furious vivacity. We need remedies for just such cases, remedies which will calm the irritable, weak nerves and permit the disease to proceed in its normal course. The following may prove beneficial in diseases embraced by a condition of non-reaction from irritable weakness. Musk, ambergris, asafoetida, valeriana, castoreum, coffea, uh, scutellaria, Cypripedium, coca, ginkgum ox, china, camphor, agaricus, and tarantula. We have completed Calcarea sulf in Kent. Now we will read in Clark, Calcarea sulf, Clark Dictionary of Metromedica. Calcarea sulfurica, sulfate of calcium, gypsum, plaster of Paris, trituration. Calcarea sulf is closely related to hepar sulf calcarea, which is an impure sulfide of calcium but has a wider sphere and deeper action in suppurative processes. It is Schussler's connective tissue salt, and most of the indications for its use are derived from his clinical experience. In the last edition of the biochemical therapy, Schussler discards calcarea sulf because it is not an actual constituent of the tissues, and he distributes its functions between silicea and natron phos. Homeopaths having no biochemical theory to support may continue its use without scruple, especially as it has been proved by Herring and others. It is indicated in all kinds of cases after pus has found a vent. Nash has cured a case of suppurating kidney with it. It differs, it differs from hepar in sensitiveness to air. Hepar cannot bear the slightest exposure. Calcarea sulf has amelioration in the open air, better walking in it, desire for it. Both have aggravation from change of weather. Calcarea sulf has not the excessive sensitiveness to touch found in hepar. Hansen recommends it in dry eczema in children. Cystic tumors, fibromata, and polypi have been cured with calcarea sulf. Compare calendula, hepar, calimur, natrum sulf, post-scarlatinal dropsy, silicea, hard or suppurating glands, ulcers of cornea, tonsillitis, mastitis, frostbites. Follows well calimur, natrum sulf, and silicea. In Clark it is given very little. Next group we will read. Calcarea group is over now. What is the next group? కాదు ఆ తర్వాత మధ్యలో ఇంకో గ్రూప్ డిసైడ్ చేస్తాం. ఇప్పుడు రాసేస్తే అవన్నీ చదవచ్చు. మోస్చెస్, నక్స్ మోస్చెట, వెలేరియానా, cyclamen, Castoreum. చూద్దాం వీటికి ఇంకేమైనా యాడ్ అయితే అవ్వాలి. ఎందుకంటే హిస్టరికల్ రెమెడీస్ అని గ్రూపు. అగారికస్ మళ్ళీ వేరే వస్తుంది, అవన్నీ వేరే. ఇగ్నీషియన్, ఆట్రోమూర్ అవన్నీ మళ్ళీ వేరే గ్రూప్. యాంటిమ్ క్రూడ్ కూడా, క్యామిలా, నక్సాక అవన్నీ వేరే గ్రూప్, అది వేరే. ఇవాళ మాస్టర్స్ కొద్దిగా స్టార్ట్ చేసి నెక్స్ట్ దానికి వెళ్దాం. ఆల్రెడీ మాస్టర్స్ మనం వేరుగా చదివేసాం, కానీ ఈ గ్రూప్లో మొదలు పెడతాంగా. ఫస్ట్ సెంటెన్స్లోనే ఇచ్చేస్తాడు మొత్తం, దీని తాలూకు జిస్ట్ మొత్తం ఇచ్చేస్తాడు అసలు. కెంట్లో మాస్టర్స్ క్యూర్స్ మెనీ హిస్టరికల్ గర్ల్స్ who have come to adult age without ever learning what obedience means. In that first sentence itself, he has given all the thing about masters. Masters cures many hysterical girls who have come to adult age without ever learning what obedience means. They are self-willed, obstinate, and selfish. When they have been encouraged to resort to crafty cunning to have everything whim gratified from infancy to 18 years of age, they become fit subjects for Moschus, Asafoetida, Ignatia, and Valeriana. అసలు ఇట్లా ఎసఫోటెడా ఒకటి రాయాలి. ఎసఫోటెడాలో దీంట్లో ఉన్నాయి, హిస్టరికల్ సింటమ్స్ ఉన్నాయి. ఎసఫోటెడాలో చాలా క్రానిక్ డైజెస్టివ్ డిజార్డర్స్. పక్క పేషెంట్స్ అందరూ మదర్ టీచర్లో ఎసఫోటెడా మదర్ టీచర్ అంటే ఇంగోగా ఎసఫోటెడా. చాలా వండర్ఫుల్ రెమెడీ. కొన్ని కేసెస్లో అసలు ఎక్కిళ్ళు క్రానిక్ హిక్కాఫ్ వస్తాయి, ఇంకా దేంతో తగ్గవు, ఎసఫోటెడా వేసి తగ్గుతాయి. అది వీనస్ సైడ్ ఆఫ్ సర్క్యులేషన్ మీద బాగా పనిచేస్తుంది ఎసఫోటెడా. క్రానిక్ జిఐటీలో బాగా పనిచేస్తుంది. క్రానిక్ హిక్కాఫ్స్తో కొన్ని నెలలు సంవత్సరాలు సఫర్ అవుతారు కొంతమంది. అసలు ఆ హిక్కాఫ్స్లో మాస్టర్ గారు ఇచ్చిన డైమెన్షన్లో ఎంపీతో బ్రహ్మాండంగా తగ్గుతాయి. హిక్కాఫ్స్ విల్ బి కంప్లీట్లీ రిలీవ్డ్ విత్ మెగ్నీషియా ఫాస్ట్. Master has given that dimension. With magnesia for 6x or 12x, you mix 10 tablets in water. For every 2 hours, you give 2 spoons. The hiccough will stop. Or daily 3 times 2 tablets you give, hiccough will be stopped. Magnesia fast works almost as a specific for all the types of hiccoughs. But the hiccoughs which are accompanied with liver disorders, especially with liver disorders and liver failures, Asafoetida will improve. Not only with in chronic hiccoughs, with any gastric disorders, not only with liver failure, They also, stubborn cases, they can also be cured with a supported. They not only have volumes of real and they, they not only have volumes of real and imaginary symptoms, but they become adepts at adapts at producing at will a kaleidoscopic complex of symptoms, increasing in quantity and in intensity until their own desires are attained. And the onlooker, be he or she nurse, physician, or bewildered mother, is overwhelmed, dismayed, and in retreat. వాళ్ళ కోరికలు తీరేంత వరకు, వాళ్ళు అనుకున్నది అయ్యేంత వరకు ఎలాంటి సిమ్టమ్స్, ఎలాంటి డిసీజెస్, ఎలాంటివైనా వాళ్ళు ప్రొడ్యూస్ చేయగలరు. ఎంత హారబుల్, ఎంత సివియర్ అంటే కొన్ని కేసెస్లో తలనొప్పే కాదు కన్వర్జన్స్ వస్తాయి, హారబుల్ కన్వర్జన్స్ వస్తాయి వీళ్ళకి. ఎన్ని ఇష్టం ఎలాంటివైనా వస్తాయి. క్యామిలా వాళ్ళకి, మాస్టర్స్ వాళ్ళకి, వాళ్ళు ఎలాంటివైనా తెప్పించుకోగలరు. ఇగ్నీషియాకి ఉంది, వేళల్లో చాలా ఎక్కువ. ఈ క్యామిల్లా తాలూకు నేచర్ బాగా తెలియాలంటే మాయాబజార్లో రేవతి ఆవిడ తలనొప్పి ఎంతలా తెప్పించుకుంటుంది. సుభద్ర వచ్చేసరికి, వాళ్ళు ఓడిపోయాక సుభద్ర వస్తుంది, అప్పటిదాకా బాగా డాన్స్ దర్జాగా ఉంటుంది. సుభద్ర వస్తుందని తెలిసేసరికి తల గుడ్డ కట్టుకుని తలనొప్పి ఏమో బ్రహ్మాండమైనటువంటి ఇది చేస్తుంది. అలా ఏదైనా తెప్పించుకోగలరు. However much they pretend to be honest and truthful, their reported sensations are untrustworthy. Wonderful expression. However much they pretend to be honest and truthful, their reported sensations are untrustworthy. They have traded upon their sensations and imagination so long as that a direct effort to give a truthful statement is unsuccessful. The most erratic and unexpected neuropathic phenomena are always in appearance. The physician cannot measure these cases by his experience and say what is common and uncommon. He is compelled to fall back upon the one word that covers a multi-trade of these manifestations with hysteria. Multitude, hysteria. It help hysteria అనే word. Moschus is often indicated in these constitutions and cures much that is morbid when its own peculiar symptoms agree. When one of these girls becomes sick from taking cold, the acute symptoms will be told with a host of her imaginary sensations. The globus hystericus is generally present: hyperesthesia of the skin, quivering of the muscles, wakefulness, palpitation, excitement, fainting and trembling, dreadful pain all over the body, rush of blood to head, cramps in hands and feet, convulsions of whole body. It is not generally known that the morbid sensations and functions correspond with the mental state of the individual. When the functions and tissue symptoms are hysterical or erratic, the mental state will be found to be correspondingly hysterical. When the peculiar moisture symptom of the face is present, with one cheek red and cold, the other pale and hot, ఇది హిస్టరికల్ వాళ్ళలో చాలా కామన్. ఇది చాలా డ్రగ్స్ ఇస్తాడు. There is certainly some hysterical perversion in the mind of the patient. Many times it is possible to suspect morbid mental states by knowing morbid sensations and functions. There is a kind of order in all morbid expressions seen in sick people. Sensitive to cold and complaints come on from becoming cold. In addition to numerous hysterical mental symptoms, she has violent fits of anger with rage and scolding until she is blue in the face and falls in a faint. Dread of death, and talks only of death when there is no serious complaint. ఏ కంప్లైంట్ లేకపోతే పోతే బాగుండు, చచ్చిపోతే బాగుండు, లేదా చస్తాం, ఇలాగ దాని గురించే మాట్లాడుతూ ఉంటుంది. Anguish and palpitation, peevishness and quarrelsomeness. It is in a constant hurry and lets things fall from her hands. Foolish gestures and complaint of pain, apprehension, trembling and palpitation, fear of lying down lest she die. So that is for today. स्वस्ति प्रजाभ्यः परिपालयन्तां न्याय्येन मार्गेण महीं महिषाः गोब्राह्मणेभ्यः शुभमस्तु नित्यं लोकाः समस्ताः सुखिनो भवन्तु लोकाः समस्ताः सुखिनो भवन्तु समस्ताः सुखिनो. ॐ शान्ति शान्ति शान्तिः. वासुदेव.